Hello, I'm Dr. David Hornbrook, and we're going to talk about something I never skip on Cementation Day. Someone asked me in a lecture a couple weeks ago, is there something that you always do that you absolutely would not forget to do on Cementation? This is one of them. Robin's in Provisionals. She's been in Provisionals for 2 weeks, and we're going to see 10 e.Max veneers. There's always a chance, doesn't happen very often, but it does occasionally happen, when we take off our Provisionals, we don't like the final results of the ceramic. It could either be shape, fit, or shade. And so in those circumstances, I would try in her restorations. If we don't like them, I've got to make new Provisionals. She's had her Provisionals for 2 weeks. The tissue response is excellent. She likes the way they look. In fact, one of the comments she made when she came in was that she hopes the definitive restoration looks as good as her Temporaries. I suggested that she just wears these until they break, and then she can give me a call probably Saturday night, and I won't, but I could come down and actually cement the definitive. So we're going to take an impression. This is so important. I'm going to put an Optrogate in. This is by Ivoclar. It's a non-latex, flexible cheat and lip retractor. Relax your upper lip a little bit. Close down a little bit. Good? Is that okay? Okay. Then I like to take an anterior triple tray. There's several brands on the market. I like to use a clear bite registration material. Again, there's several brands on the market. It's a matrix material. And then just a light body whoosh. So we'll go ahead and dry off the teeth. Turn toward me. Okay. We're going to go ahead and overload the maxillary portion of that tray and put just like a thin bead on the mandibular. So I'm going to put this around the margins because I want this to be a very accurate impression. So we're going to go all the way back to the second bite since we're restoring our maxillary anterior 10 teeth against the soft tissue. We'll go ahead and take the triple tray, open for me a little bit, bite down all the way through it, and make sure it's seated all the way. Then we'll let that set the 2 minutes that it requires, and then we'll take a look at it. All right, so we went ahead and let this set for 2.5 minutes. Open for me. Go ahead and gently take this out. We'll look at it and make sure we've captured all the gingival margins. Perfect. And then what I'll do with this is I actually take the plastic and I peel it away from the impression material. So what this is giving me is almost like a putty matrix that a lot of people use to make the Provisionals after a wax up. It's a flexible putty matrix. So now if I do need to make Provisionals, then I can use this with the shrink to fit technique.